Through chapters 1 and 2, we've taken a look at dietary selections, basically for us as Americans. But consider this, despite wherever we live in the world, we are connected in our necessity for food to maintain life. Food has been described as the great single unifier across all cultures. If you review the attached reading, What Americans Learn from Other Food Cultures, you'll see the impact of various cultures on our food selections. What you'll see as you go through the assigned reading, the assigned link, is a correlation with food as identity, food as survival, food as status, food as pleasure, food as community, and food as humanity. We've also mentioned a few health organizations in the United States which help guide us in healthy directions, whether it's food selections, lifestyle, fitness, etc. There are also various organizations which work on a global stage to help with achieving and maintaining health. And one of the major organizations is the Food and Agriculture Organization, or FAO. You could see it has a vast amount of members from various countries, and it focuses on three main goals. The first is to wipe out hunger. Along with hunger, food insecurity as well as malnutrition. Also to eliminate poverty, as well as trying to achieve economic and social progress and growth for everyone. And then lastly, another main goal is in sustainability. We want to make sure that we have the capability of sustaining our resources to ensure a healthy environment for future generations. Now, the concept of sustainability, we will go into much greater depth when we go through Chapter 20. Another important agency to note is the World Health Organization, or WHO. It's associated with the United Nations, and it also has a large amount of members from various countries. You can see that their objectives or goals are more extensive than the FAO. The World Health Organization works on improving the health services, especially to developing countries. They also develop programs to improve standards for nutrition, housing, economic progress, working conditions, and so forth. They also play an extremely important role in programs which promote or even improve maternal and child health and welfare. They have programs specifically to work in the field of mental health, and they also focus on many problems in public health. With both the World Health Organization and the Food and Agriculture Organization, nutrition is a large component of their focus. We had reviewed dietary guidelines for the United States, but there are also dietary guidelines for other countries which are strongly promoted by these agencies. In fact, there are currently more than 100 countries that have dietary guidelines established.